Hi, my name is Tori Johnson, and today I'm going to be demonstrating the skill of changing a sterile wound dressing. Throughout this entire procedure, I would make sure to follow all GPSP guidelines. If medication needed to be administered at any time, I would follow the 3 checks and the 11 rights. Okay, so I would knock while entering patient room. Hi, my name is Tori. I'm going to be your nurse today. Can you tell me your name and date of birth, please? Okay, perfect. That matches our wristband. Okay, today we are going to be doing a sterile dressing change on your surgical wound. Is that okay with you? Yes, okay. Do you mind telling me if you're in any pain right now on a scale of 1 to 10? Okay, your pain is on a 2 because your pain medication from earlier is working. Okay, that's great. All right, do you have any allergies that I need to know about today? No? Okay. And have you noticed feeling any changes around your surgery site? Nope. Right. Well, then if that is okay with you, we are going to go ahead and get started. Okay. All right. So I'm going to go in using the push and pull method, careful to not put a lot of pressure on that incision. If for any reason this was getting stuck to the skin, I could go in with sterile saline to help break up some of that adhesive from her skin to prevent causing any damage. Okay, I would remove that. At this point, I'm going to use Taco to assess the old bandage and the wound. Taco is going to be type, amount, color, consistency, and odor. Okay. So I will be able to chart all of that properly. I'm also going to check to make sure that her wound has not had any changes since last time. I'm going to assess with my patient to make sure she's not in pain at any point. Okay, so now I will do my hand hygiene. I'm going to make sure that I have all of my proper sterile equipment. Okay. By doing so, I'm going to look at the packaging to make sure that it is not expired, it is not open or tampered with, there's no moisture, and everything inside is still sterile. So my gloves and my kit are both not expired and freshly not open. Okay, so I'm going to flip that over. Careful not to touch anything inside of that because it is all sterile. Gloves. At this point, I'm going to do hand hygiene one more time.
I did. Right in the middle of that too.
I kind of pinch these corners just to make sure everything lays flat onto the table. Only touching that 1-inch border.
Yeah, if I lived any further away, I would have been upset.
Pull that on, only touching the cuff of the glove. Keeping that away from my body. I made sure I have no jewelry on.
Right off of Route 5 in Westwood. So, like, we have to be at clinicals at 8. I can leave my house at like 7:54. And get there. It is super nice.
Okay. Once I have that on, I can use the sterile parts of my gloves to properly adjust them. Okay, so once I have my gloves on, we're going to go. Okay, I'm going to start with the middle, going top to bottom. Dispose of that while also keeping my hands above my waist, keeping my gloves off of non-sterile skin on the patient, nightgown, or bedding. Clean top to bottom. Discard of that, and I'm going to go in, start with the center, and pat dry. Throughout this entire time, I am going to make sure that I'm assessing with my patient to make sure that she is not in any pain. Okay. Remove these old gloves. Perform hand hygiene once more. Do the same thing, checking packaging, making sure that these gloves are not expired and that they have not been tampered with in their packaging.
That is a moist item.
Start with the top, doing that pinch method once again to keep them down. Pinching again at the bottom, opening from the inside. Back. Is there a hole in them? Okay. Backup pair of gloves. Checking the packaging once again.
Just have that in the background.
Do my hand hygiene. Okay. So I'm going to start once again from the top. Keeping my elbows out, not reaching over the gloves. Pulling gloves outward. Okay. I'm not going to reach over that glove, so I'm going to step to the side. Step back. My fingers. Slide that hand in. Okay. Alright, so from this point, I'm going to reapply this sterile dressing on my patient. Tape these sides down. Put this tape on, and on this tape I would put today's date, my initials, and the time for when this dressing change was made. Dispose of my gloves, clean up my mess. I would reassess my patient's pain once again, make sure the bed was lowered, call light is within reach, and answer any questions or concerns that my patient might have.